Hi, my name's Callie. I'm a senior nursing student and I'm going to be showing you how to do the newborn baby assessment. Before you begin your assessment, you want to make sure that you have all of your supplies. So you'll need your stethoscope and a pair of gloves. You'll also need to check the computer to make sure that the vital signs have been documented and that they are within normal limits. When you go into the room, you'll want to do all of the normal things. So you'll want to pull the curtain for privacy, perform hand hygiene before putting on your gloves, and you'll also want to introduce yourself to the parents. You'll want to make sure with the parents that it's okay that you are assessing their baby, and you'll also want to have the mother identify the baby. When the mom identifies the baby, you want to compare whatever is on the baby's wristband to what the mom says and make sure that they match. For the purpose of this video, we're going to be pretending that we're doing the baby's initial assessment. You would be doing this underneath the radiant warmer, so the baby will not have a hat on, and they most likely they won't be swaddled either, so they most likely will not have had their initial bath yet. So you're going to be wearing gloves throughout this entire assessment. So you want to make sure that you put your gloves on, and if the baby has identification on right when you're doing your initial assessment, which they should, you'll want to just go ahead and check that once again. Make sure this is the right baby. So like I said, the baby will be underneath the radiant warmer, and you want to disturb the baby the least possible, so we're just going to start the assessment with observation. So first we're just going to assess the baby's sleep-wake cycle. There are 6 different cycles that the baby could be in. The first one is deep sleep. This is when the baby is in a very deep sleep. They're hard to wake up, and they'll only start waking up when you're moving them around and start touching them. Next is light sleep. This is when the baby is sleeping, but they start to wake up when you're close to them and talking and just kind of interacting around them. Next is drowsy. This is when the baby's eyes are droopy. 1 minute they're asleep, 1 minute they're awake. So you just would want to note that if that's how the baby is. Next is quiet alert. This is the ideal state for the baby to be in. This is when the baby's awake, but they're very pleasant, they're cooing, they're not agitated or anything like that. Next is active alert. This is when the baby's starting to get fussy and moving around a little bit more. Next is crying, which is obviously when the baby is agitated and crying. Next we're going to look at the baby's head. So you're just going to assess the skin on the baby's head. Make sure that there's no cuts, bruises, and that the skin is intact. Next you're going to look at the suture lines. You want to palpate them, and you'll note if they're either split, approximate, or overlapping. They can be any of these. You would just want to note what you feel. Next you're going to feel the fontanelles. So you'll palpate the anterior fontanelle, which is diamond shaped. And then you can follow the suture line back to the posterior fontanelle if you're having a hard time finding it. And the posterior fontanelle is triangular shaped. It's significantly smaller than the anterior fontanelle. When you palpate the fontanelles, you want to make sure that they're not bulging or depressed. They should be soft and flat. If the fontanelles are bulging, this could be because of intracranial pressure, increased intracranial pressure, such as hydrocephaly. If the fontanelles are depressed, this could be because of dehydration. Next, you want to look for any generalized swelling on the baby's head. There are 2 types of swelling, or edema, that we're looking for. The first one is caput succedaneum. This is when there's edema under the layer of the skin that's covering the skull. Just because it is underneath the skin, it crosses suture lines. This is commonly referred to as a cone head. And this is normal. It's just caused from compression through the birth canal, and it'll go away with time. The next type of edema that we're looking for is called cephalohematoma. This is bleeding between the bone and the periosteum, which is the outer layer of the brain. Because of this, it does not cross suture lines. It's deeper in the baby's skull. You would just want to monitor the size of the bump because it is bleeding. You want to make sure that it does not get larger. Next, we're going to move on to the eyes. You want to look and make sure that they're symmetrical. You want to look for what's called subconjunctival hemorrhage. This is on the whites of the baby's eyes, and they'll be red spots. They're normal. You would just want to note and document them. The eyes should not have discharge, and if there's edema on the eyelids, that is normal as well. Next, you're going to check the nose. It should be midline. You also want to check the patency of the nares, because babies are nose breathers for the first couple of weeks of life. So first, we're just going to lift up the baby's chin, put your finger over the baby's mouth, and then occlude 1 nostril at a time. Each time you occlude a nostril, you want to make sure that you watch the chest and make sure that it is rising. When you occlude the nostrils, you want to occlude it from the outside and towards the middle of the nose. Next, we're going to move on to the mouth. When you're assessing the mouth, you want to look for what's called circumoral cyanosis. This is a blueness around the mouth. If you notice this, you want to stop your generalized assessment immediately and go to a respiratory assessment, which I will show you how to do in a second. If you do your respiratory assessment and everything is normal, then most likely the blueness around the mouth is bruising. In that case, it is not called circumoral cyanosis. So, after you have assessed for circumoral cyanosis, you can go ahead and test the sucking reflex. So to do this, you're going to take your finger and put it in the baby's mouth. You're going to put the soft pad of your finger up. When you do this, the baby should suckle on your finger. With your finger in the baby's mouth, you should feel around. Feel the hard and soft palate, make sure that they are intact. And you also want to feel the gums, make sure that they're pink, moist, and that there's no teeth. You also are going to check for the rooting reflex. When you do this, you stroke the baby's cheek from the ear to the mouth, and when you do this, the baby's head should turn towards your finger. And you want to do that on both sides. Next, we're going to check the baby's muscle tone. When you're looking at the baby's muscle tone, their extremities should be moderately flexed, which means that they're curled in. They should not be flaccid, which means the extremities are loose. This could be caused if the baby is malnourished or if the mom was under medication during the labor or birthing process, such as magnesium. If the baby is too rigid, which means the baby is extremely stiff and board-like, this could mean that the baby is a withdrawal baby because the mother used drugs during the pregnancy. If you know any of those, you would want to make sure that you take the actions necessary for those. Next, we're going to assess the chest and do a respiratory assessment. If you want to make sure that you're looking for respiratory distress in the baby. Signs of respiratory distress are nasal flaring and substernal and intercostal retractions. So this is when the muscles between the ribs or the sternum looks like they're getting sucked in. This is caused when the baby is just trying to get extra air in and out with each breath. Next is you want to assess for grunting when you auscultate. Grunting is often mistaken for crying to the untrained ear, and it is at the end of each exhalation. So you would want to make sure that you become aware with what grunting would sound like. So next we're just going to auscultate the baby's breath sounds. So we're going to do this in a pattern. We're going to start in the right upper lobe, the left upper lobe, right middle lobe, right lower lobe, and left lower lobe. When you listen, you want to make sure that you don't hear any grunting, like I said. You also want to make sure that you don't hear any wheezes or crackles or anything like that. Next, we're going to auscultate the heart rate. Auscultate heart sounds now. The heart rate, we'll do that in a second. We're going to do this in 5 different areas. So first, we're going to go to the right sternal border, the second intercostal space. This is the aortic valve. Next, we're going to move over to the left side, to the left sternal border, second intercostal space. This is the pulmonic valve. You're going to move down to the third intercostal space, left midclavicular line. This is Erb's point, and this is where you're going to listen to the heart rate for 1 full minute. You want to listen like I said, for 1 full minute, and the normal heart rate is 110 to 160 beats. Next, you're going to move down to the fourth intercostal space, left sternal border. This is the tricuspid valve. And then you're going to move down 1 more intercostal space to the fifth intercostal space on the left sternal border still to the mitral valve. And then you're going to assess the clavicles. You want to palpate them, make sure that they are intact. You also want to test for dislocation or a broken clavicle. The way you do this is you're going to put 2 fingers where the clavicle is and rotate the baby's arm in a circle. When you do this, you shouldn't feel what's called crepitus. This is a cracking feeling. It feels like Rice Krispies underneath the skin. The baby will most likely scream in pain if you do this test and they have a dislocated or broken clavicle. You want to do that on both sides. Next, we're going to assess the arms. If you haven't already, go ahead and check the baby's ID band again. You're going to look for acrocyanosis, which is normal within the first couple hours of life or after birth. This is blue hands and feet, with everything else pink. So you would want to assess for that. Next, we're going to check the brachial pulse. In babies, you take it in the upper arm. You want to do that bilaterally. Just make sure that it's strong and present. For us, if you want to test feeling the brachial pulse on yourself, you can do this by feeling your muscle. And between the muscle and your bone is where you'll find your brachial pulse. So that is where you'll find it on the baby as well. Next, you're going to check the grip reflex. So you do this by simply sticking your finger in the baby's hand, and they should grip around your finger. You want to do that on both sides. Next, we're going to assess the baby's abdomen. We're going to listen to the bowel sounds before we palpate. So we're going to listen in a pattern here as well. We're going to follow the GI tract. So we're going to start in the right lower quadrant, the right upper quadrant, left upper quadrant, and then the left lower quadrant. When you're listening, you want to make sure that you hear bowel sounds in each quadrant before you move on to the next. You could listen for up to 5 minutes in each quadrant in order to declare it absent. Then you want to palpate the abdomen. Make sure that it's soft, non-distended, and that it's also round. You want to look at the umbilical cord. If the baby has just been born, which we're doing the baby's initial assessment, so we should be able to see 2 arteries and a vein on the baby's umbilical cord. However, if you're doing this assessment and baby has been born for a couple days now, the umbilical cord will most likely be dry. It should be clamped and not have an odor or be crusty or anything like that. Next, we're going to look at the legs. You want to look for symmetrical leg folds. So the way you'll do this is just lift up the baby's legs and look underneath the thighs. I'll show you here what we're looking for. So you'll want to just look at the baby's thigh folds, make sure that they're symmetrical. Next, we're going to do the Babinski reflex. So when you do this, you will take your finger, stroke the baby's heel to the toe in a C shape, and when you do this, the baby's toe should flare. Next, we're going to check the plantar grip reflex. The way you do this is just stick your finger underneath the baby's toes, and the baby's toes should grip around your finger. You would want to do that on both sides. Also, when you look at the baby's soles of their feet, they should, if it's a full-term infant, the lines on the soles of the baby's feet should go 2/3 of the way down on the baby's foot. Next, we're going to assess the genitalia. If it's a male, we're going to palpate the scrotum, make sure that both testes have descended. We also want to assess for rugae, which is a the wrinkling skin. Make sure that that's present if the baby is full term. You want to look at the penile tip, make sure that the urinary meatus is at the tip, that it's not deviated. If the baby was circumcised, you want to look at the circumcision site, make sure that there's no discharge or bleeding. If there is bleeding, hold pressure until the bleeding stops. Next, you want to look for a patent anus. So if the baby has passed their meconium within the first 12 to 24 hours, then the anus would be patent. If the meconium is the baby's first stool. So you would just want to ask the parents or check documentation if you're not doing the baby's initial assessment like what we are right now. And then for the female, the anatomy may be edematous due to the birthing process. They may also have a pink vaginal secretion, which is normal due to maternal hormones. And also with the female, you would want to make sure that their meconium has been passed within 12 to 24 hours after birth. Next, we're going to turn the baby over and assess the spine. When you turn the baby over, you want to make sure that you support their head and their trunk. And when you're turning the baby over, make sure that they turn their head. When you're assessing the spine, you want to make sure that it's vertical and midline and that it's easily flexed. So when you turn the baby over, you notice that the baby was pretty flexible. Next, you want to look at the sacral area. You want to look for a sacral dimple or hair tuft to rule out spina bifida. You also, if the baby is a darker skinned baby, you would want to look for what's called Mongolian spots. These are darker pigmentation, and it's kind of like a birthmark, but it can be mistaken for a bruise, so you want to make sure that you document it well. Finally, we're going to turn the baby back over to his or her back. And we're going to do one last reflex, which is the moral reflex or the startle reflex. So how we do this is there's two ways that we can do it. The first way So you're going to pick the baby up by the hands, making sure that their head stays on the table, and then gently dropping the baby. When you do this, their extremities should flare up like this, and their hands should make C shapes. Another way to startle the baby is to simply kind of hit the surface that the baby is on. They should have the same reaction to this as well. So we're going to go ahead and dress our baby after our initial assessment, and that we're assuming that we have given it his bath now. So we're just going to put the diaper on. And then we'll put a hat on the baby. Then we'll take off our gloves, throw them away, perform hand hygiene, and then lastly we'll swaddle the baby. So you want to make sure that you're holding your baby correctly. Swaddle the baby tightly, and then after you swaddle the baby, you can give them back to the parents. Thank you.